Welcome to my video on understanding mental health. My name is Dr. Gordon Ambayo. I'm a consultant psychiatrist and a lecturer at Kenya Methodist University and chairman of the Department of Psychiatry at Kenya Methodist University in Meru. Good mental health is key to good physical and emotional well-being. Mental health includes our emotional, physical, and social well-being, and it affects how we think, feel, and act. Now, it also helps determine how we handle stress, relate to others, and make choices. Why are we talking about mental health? Talking about mental health improves our communities by making it more acceptable for those suffering from mental health to seek mental treatment. It also helps those who have mental illness recover from the illnesses they are undergoing treatment for. Now, what is mental health? When we talk about mental health, we are talking about our mental well-being, and that includes our emotions, our thoughts and feelings, and our ability to solve problems and overcome difficulties. It concerns our social connections, our understanding of the world around us, and our ability to meet everyday demands in life. Now, what is a good mental health? For you to have a good mental health, you should be able to participate in everyday activity without being non-productive, and also be able to undertake, also be able to handle stress and other disappointments that may come about in your life. Now, in order to maintain good mental health, you must practice ways of coping with challenges in life, which includes disappointments and also disagreements and stresses and anxiety we come across in our daily lives. If these conditions are not properly handled, then we may develop serious mental illnesses. Now, what's a mental disorder? A mental disorder is an illness that affects the way people think, feel, behave, and interact with others. And there are many different mental illnesses that can have different symptoms and signs and impact us in our daily lives. Now, mental health professional can provide a diagnosis and prescribe the necessary medication to those who have mental illness. You may also get counseling services to help you alleviate the psychological symptoms of the mental illnesses. Now, when we deal with mental illness, we also have problems of stigma and discrimination. Now, stigma is when somebody sees you in a negative way because of the illness you have. And discrimination is when someone treats you in a negative way because of your mental illness. So we should be able to treat or handle our patients with mental illness in the society without any stigma and discrimination, and without them also feeling being stigmatized and discriminated against. There are several types of stigma. We have self-stigma, then we can also have a public stigma, and also we may have professional or institutional stigma. Now, self-stigma is when somebody develops negative attitude towards himself or herself because of the mental illness they have. And this can make them not go for treatment. Now, we need to handle mental illness like any other sickness, just like malaria, sore throat, diabetes, and other heart diseases, so that we view these patients just as any other patient. And then, because these illnesses, some of them can be treated and the patients get cured, and some of them, the patient may be on treatment for the rest of their lives, but with good medication and compliance to medication, they will be able to go about with their day-to-day activities. There are very few mental illness patients who may not be able to do productive work, but majority will be able to do some work and even earn a living once they comply with their medication. Now, what are the warning signs of mental illness? Now, some people become paranoid. They feel everybody is against them, and they accuse people of planning to do some harm to them, and also not giving them their rights or whatever they deserve in the society. So these are people who are paranoid. They may make false accusations against people either living with them or working with them. They have a lot of mistrust and unfounded accusations. Now, some people have sadness, long-lasting sadness, which occurs in depression. And then these people may also have lack of sleep or difficulty falling asleep or waking up early in the morning. Again, this one occurs in depression. Some people with mental illness also become easily irritable. Irritability occurs in depression and is also very common in children with depression, children and adolescents with depression. Now, some people have extreme change in their mood. Sometimes they are sad, and sometimes they are very happy. The mood is elated. This occurs in mania. For those who have bipolar disorder, they normally have stages where they are depressed and also a stage where their mood is excessively very high. The other signs of mental illness are flight of ideas. Some people talk of so many ideas at the same time, jumping from one idea to the other, and others may have other signs like social withdrawal. They withdraw from the community or from their workmates so that they always do their things or activities alone, and they don't want to mix with others. Other signs are changes in appetite and eating habits. Some people, when they have mental illness, they eat excessively. Some eat very little, and this can occur in depression. In certain types of depression, some patients eat very little, and there's a type of depression we call atypical depression, where the patient eats a lot, gains weight, and also sleeps a lot excessively. Now, some patients develop hallucinations. Hallucinations are a perception without a stimuli. Somebody perceives something to exist which is non-existent, like hearing voices of people who are not existing. That is known as auditory hallucination. We also have visual hallucination, where people see things which do not exist or which other people are not seeing. Now, visual hallucinations are more common in people who abuse alcohol and drugs. Those who have abused alcohol and drugs excessively and for a long time normally have visual hallucinations. Now, what are the causes of mental illness? The mental illness are caused by three major things. Some are biological, some are psychological, and some are social. The social environment in which we stay or live can cause our mental illness. Now, Amongst these biological, psychological, and social factors, we have the infections. Infections of the brain can be by parasites like malaria, can be by bacteria like tuberculosis and syphilis bacteria and other bacteria which can cause mental illness. We also have viruses like HIV virus, which can cause mental illness known as HIV encephalitis. Now, we have things like tumors. Tumors are growths, abnormal growths that can occur in the brain, and this can present like a mental illness because they interfere with the brain. Then we also have chronic medical conditions like diabetes, cancers, which later on can lead to depression. Other causes of mental illness are social and emotional stressors, like financial problems. Financial problems can lead to anxiety, and this can also lead to depression. We also have people who may not be living happily with their spouses. There are a lot of quarreling. These are also social factors that can lead to mental illness. We also have things like domestic violence. Domestic violence, if it occurs several times, can lead to things like post-traumatic stress disorder. Then we come to genetic factors. Some of the patients with mental illness have a very strong family history of mental illness, like those who have bipolar disorder. When you take history, you find almost 70% of patients with bipolar mood disorder will have a history of family history of mental illness. However, there are several patients with mental illness who do not have a family history of a mental illness. Now, other causes of mental illness are damage to the brain from trauma. You may get involved in a road accident and injure your brain, and there could also be bleeding into the brain. And even although you may undergo surgery, the injury to the brain may not recover, and somebody may end up with a mental illness. Other causes of mental illness are alcohol and drug abuse. Those who abuse alcohol and drugs for a long time and even taking high doses later on develop mental illness, and some of them can have psychotic features. Psychotic features means you have hallucinations and delusions. You see things other people are not seeing, or hear voices other people are not hearing. And also in delusions you have false beliefs which are fixed, but they are not true according to the culture and the environment where you live. So alcohol and drugs can be a problem leading to mental illness. Now we also have some chemicals in the brain known as neurotransmitters. These neurotransmitters, when they dysfunction, they can lead to mental illness. For example, we have a neurotransmitter known as dopamine, that if it is in excess in the brain, it can lead to mental illness as schizophrenia and bipolar disorder. Then we have neurotransmitters like serotonin, which when is not enough quantity of it in the brain, it can lead to depression. So neurotransmitters, these are chemicals that help the brain nerve cells pass information from one nerve cell to the other. So when they are dysfunctional, you can get a mental illness. Other things are birth trauma. If a child gets traumatized during birth, the brain is damaged, and also issues like prolonged labor. During prolonged labor, the brain may not have enough oxygen, so the brain will get damaged, and these children may develop things like cerebral palsy or intellectual disability, and some of them may also have convulsions and epilepsy as a result of birth complications. So basically, those are the causes of mental illness. Now, what are the most common types of mental illness? We have things like stress leading to anxiety and depression. Then we have also behavioral and emotional disorders, which are common in children. Then we have bipolar mood disorder. We can also have illnesses like schizophrenia, which is one of the most severe mental illness, which also lead to the patients not functioning well. We have alcohol and drug abuse. Then we also have people who have sexual dysfunction, like erectile dysfunction in men, and frigidity in women. So these people may not enjoy sex. Now, we also have eating disorders. There are people who eat too much, leading to illnesses like bulimia nervosa. And then those who don't eat enough, they restrict what they're eating, and this will develop anorexia nervosa. Now, we also have things like obsessive compulsive disorder, which are quite common. Now, mental illness is preventable. Some mental illnesses can be prevented, and these, like the ones due to social issues and emotional issues like stress, can be prevented by lifestyle modification. If you eat well, do enough exercise, and take leave, you can prevent these mental illnesses caused by stress. Then good obstetric care and good delivery by qualified personnel to prevent prolonged labor and birth trauma can also prevent mental illnesses like cerebral palsy, intellectual disability, and convulsions in children. Now, abstaining from alcohol and drug abuse can also help prevent mental illness, which presents with psychosis, depression, and memory loss, and even insomnia, lack of sleep. Now, what can you do routinely to prevent this illness? We have mentioned, number one, do exercise, regular exercise daily. Minimum, if you can do it daily, should be minimum 4 times a week. And exercise should take at least 45 minutes. Number two, have adequate sleep, at least 8 hours per day. Then you should set your goals in your day-to-day activities, and so that you can achieve defined goals. Don't just work without having goals. Now, as we have said earlier on, eat healthy and nutritious diet. A nutritious diet should consist of carbohydrates, proteins, fruits, and vegetables, and avoid fatty foods. We should also socialize. Connect with your friends, relatives, and visit your friends and relatives. Again, when your relatives have problems, go and condole with them. If there are funerals, join them. If there are weddings, join them. Parties, join them, so that you have social connection with other people. Share your personal problems with others. Don't keep your problems to yourself. It will lead to stress and depression and even suicide. Tell someone how you feel about your mental health, and ask for help. If you feel you are sad, you are depressed, you are anxious, ask for help. Thank you very much for listening. Subscribe to my channel, and we'll have more topics on mental health. In case you have mental health questions, you can get me at my email, drambayo15@gmail.com, and also my mobile number is 0722 396986. I repeat, my mobile number is 0722 396986. Thank you.